Bismillahirrahmanirrahim. Today our topic of discussion is the pudendal nerve, which is the chief nerve of the perineum, and travels in the pudendal canal along with the internal pudendal vessels. Its origin arises from the sacral plexus from the nerve roots S2, S3 and S4, and after passing through the greater sciatic foramen it enters into this bluish pudendal canal shown over here, which is there in the lateral wall of the ischioanal fossa. And from the medial wall of the pudendal canal, a branch of the pudendal nerve arises, which is the inferior rectal nerve, which is responsible for supplying the skin around the anus and the external anal sphincter, and it is also responsible for supplying the lining of the anal canal below the pectinate line. And then it gives two terminal branches, one of them being the perineal nerve, which is the larger terminal branch, and the smaller terminal branch of the perineal nerve is the dorsal nerve of the penis. Talking about this perineal nerve is dividing into two branches, one of them being the labial or the scrotal branch, and the other one is the muscular branch, which is responsible for supplying the urogenital muscles. And there is another nerve that is called as the dorsal nerve of the penis, which is smaller. First, it runs in the pudendal canal above the internal pudendal vessels, like this. So it is basically above the internal pudendal vessels, and then it goes into the deep perineal space. ठीक है, deep perineal space is actually the space that is deeper to your perineal membrane. ठीक है, between these vessels and the pubic arch, and finally it passes through a gap that is between the apex of the perineal membrane and the arcuate pubic ligament. So if I try to draw, if this is the perineal membrane, there is a gap in the perineal membrane in front, which is between the perineal membrane and the arcuate pubic ligament. So this branch of the this dorsal nerve of the penis emerges over here. ठीक है, and then it is responsible when it emerges in this oval gap between the apex of the perineal membrane and the arcuate pubic ligament. It supplies the glans penis. ठीक है, as the name indicates, it supplies the glans penis and the glans clitoridis. ठीक हो गया, and it will supply also the skin of the body of the penis or the clitoris. Important clinical is the pudendal nerve block. So pudendal nerve block is better than a general anesthesia during vaginal operations. How the nerve is infiltrated? It is infiltrated near this ischial spine. It is infiltrated near the ischial spine by a needle that is passed through the vaginal wall, and then it is guided by a finger. So here the pudendal nerve is blocked, which can block all the sensations in the anus, in the perineum, in the scrotum, ठीक है, or the labium, and of the penis or the clitoris. ठीक है.